lumbar disc prolapse, group 16, subgroup 6. Objectives, anatomy and functions of the intervertebral disc, clinical features of lumbar disc prolapse, investigations of lumbar disc prolapse, treatment of lumbar disc prolapse. Anatomy. Anatomy of intervertebral discs. The intervertebral discs make up 1/4 of the spinal column's length. There are no discs between the atlas C1, axis C2, and coccyx. Discs are not vascular and therefore depend on the end plates to diffuse needed nutrients. The cartilaginous layers of the end plate anchor the discs in place. The intervertebral discs are fibrocartilaginous cushions serving as the spine's shock-absorbing system, which protect the vertebra, brain, and other structures, i.e. nerves. The disc allows some vertebral motion, extension, and flexion. Individual disc movement is very limited. However, considerable motion is possible when several discs combine forces. The IVD consists of 3 distinct components: a central nucleus pulposus, a peripheral annulus fibrosus, 2 vertebral end plates. Function of intervertebral discs. The NP serves to distribute hydraulic pressure throughout the intervertebral disc. The AF resists torsion, flexion, and extension movement of the spine, provides separation and connectivity between vertebra, and counteract forces that act to lengthen or compress the spine. They also sufficiently separate the vertebra to allow spinal nerves to exit the intervertebral foramina. Protective effect on vertebra. This shock-absorbing feature distributes forces throughout the spine, reducing the risk of fracture and degenerative changes. Clinical manifestations. Clinical features of lumbar disc prolapse. The pain starts near the back or buttock and travels down to the leg, to the cuff, or into the foot. Muscle weakness in the legs, numbness in the leg or foot, decreased reflexes at the knee or ankle. In severe cases, loss of control of the bladder and or bowels, numbness in the genital area, impotence in men, numbness, pins and needles or tingling in one or both arms and or legs, pain behind the shoulder blades or the buttocks. Investigations. Investigations of lumbar disc prolapse. Magnetic resonance imaging, MRI, the most common and accurate imaging test. X-rays, getting X-ray help rule out other causes of back or neck pain. Computed tomography, CT, a CT scan show the bones of your spine. Treatment. Treatment of lumbar disc prolapse. Physical therapy, exercise, and gentle stretching to help relieve pressure on the nerve root. Ice and heat therapy for pain relief. Manipulation such as chiropractic manipulations. Non-steroidal anti-inflammatory drugs, NSAIDs such as ibuprofen, naproxen, or COX-2 inhibitors for pain relief. Narcotic pain medications for pain relief. Oral steroids to decrease inflammation for pain relief. Epidural injections to decrease inflammation for pain relief. Surgery if conservative treatments fail to improve your symptoms after 6 weeks. Thank you.